Good afternoon, everyone. Bon après-midi à tous. Today, there are 417 new cases of COVID-19 in Ontario. There are 254 people in hospital and 158 in the intensive care unit due to COVID-related critical illness. And I'm sorry to say that there have been another 3 deaths that have been reported. A total of 35,421 tests were processed yesterday with a positivity rate of 1.5%. I hope everyone had a wonderful Thanksgiving. The weather was unseasonably warm, which I hoped allowed you to all get outside and enjoy the fall, certainly one of my favorite times of the year. I also hoped the warmer weather allowed most of us to host our events outdoors. It's still too early to measure the impact the long weekend has had on transmission of COVID-19 in Ontario, but we will continue to monitor the data over the coming weeks to see if there's been any rise in cases. Diwali is around the corner, and as is the holiday season, and it's my hope that we can keep transmission down in Ontario so that we can continue to safely spend time with our friends and family throughout the fall and the winter. I also want to thank everyone who chose to get vaccinated over the long weekend. By doing so, you're protecting yourself and those around you, your family, your friends, your coworkers, and the members of your community from the impacts of COVID-19. Our vaccination rates do continue to rise. Currently, 87.2% of eligible Ontarians have had 1 dose, and 82.6% have had 2 doses of a COVID-19 vaccine. Je désire aussi remercier tous ceux et celles qui ont décidé de se faire vacciner pendant la longue fin de semaine. Ce faisant, vous vous protégez ainsi que les personnes qui vous entourent, notamment votre famille, vos amis, vos collègues et les membres de votre communauté, des répercussions de la COVID-19. Notre taux de vaccination continue de grimper. Présentement, 87,2% des Ontariennes et Ontariens admissibles ont reçu 1 dose et 82,6% ont reçu 2 doses de vaccin contre la COVID-19. This is a remarkable achievement, and I am grateful to everyone who not only received the vaccine, but obviously to all those that have been working in the vaccine clinics over the last year and a half. In Ontario, booster doses are currently available for those at highest risk of this disease, providing an extra layer of protection against the Delta variant. Consistent with the latest advice from NACI, Ontario recently expanded its eligibility for booster doses to all retirement homes, not just high-risk homes, as well as seniors living in other congregate settings such as assisted living facilities, chronic care hospitals, and congregate seniors apartment buildings. We have also expanded the list of immune suppressant medications eligible for booster doses and have made it easier for people who are on these medications to get vaccinated. Conforme au plus récent conseil de CCNI, l'Ontario a récemment augmenté l'admissibilité aux doses de rappel pour inclure tous les foyers de retraite et plus des établissements à risque élevé, ainsi que les aînés qui vivent en milieu collectif tels que les résidences-services, les hôpitaux de soins chroniques et les tours d'habitation collective pour aînés. Nous avons également augmenté la liste des immunosuppresseurs admissibles aux doses de rappel et nous avons facilité l'accès à la vaccination pour les gens qui prennent ces médicaments. In addition to a referral from their doctor or nurse practitioner, they can now just present their prescription or medication bottle at the vaccine site as proof of eligibility. Based on current understanding from clinical and surveillance data, a completed COVID-19 vaccine series provides strong protection against COVID-19 infection and severe outcomes, including against the Delta variant in the general population. However, for some high-risk populations, a booster dose may be required to help provide sufficient protection based on waning immune response to vaccines and increased risk of COVID-19 infection. Waning immunity happens to some extent with all vaccines, but that does not mean that the initial vaccine didn't work or that the vaccines stopped working completely. Many vaccines require boosters. Take, for example, the tetanus or diphtheria shots. L'immunité diminue jusqu'à un certain degré avec tous les vaccins. Cela ne veut pas dire toutefois que le vaccin initial n'a pas fonctionné ou que les vaccins cessent de fonctionner complètement. Beaucoup de vaccins ont besoin de doses de rappel. C'est le cas des vaccins comme le tétano et la diphtérie. And as with our annual flu shots, although the formulation changes year over year with new strains of the virus, the immune response wanes between seasons, so we require annual shots to provide protection. As evidence continues to evolve, the long-term approach to vaccination against COVID-19 will evolve regarding booster doses and potential reformulations. These decisions are based on evidence on the effectiveness and safety of vaccine doses and the changes and evolution of the virus itself. But what we know from worldwide data, from the hundreds of millions of doses of COVID-19 vaccines that have been administered, is that vaccines continue to be extremely safe and effective. They offer a significant level of protection and prevent the likelihood of serious illness and hospitalization, even after several months. The bottom line is that the vaccines work. They are safe and they are effective. Mais ce que nous avons appris des données obtenues dans le monde entier auprès des centaines de millions de doses de vaccins contre la COVID-19 qui ont été administrées, c'est que les vaccins sont toujours extrêmement sûrs et efficaces. Ils offrent un important niveau de protection et préviennent la probabilité de maladies graves et d'hospitalisation même après plusieurs mois. En bout de ligne, le fait est que les vaccins fonctionnent. Ils sont sûrs et efficaces. As we move towards the holiday season, we need to remain careful and cautious and responsive to data. The good news is we have built up a considerable wall of immunity here in Ontario, and brick by brick, that wall is getting stronger. So please keep following the public health measures such as masking, good hand hygiene, physical distancing, and if you haven't done so already, as usual, I urge you to get vaccinated. Thank you, merci, and I will take any questions.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
Your first question comes from Natasha McDonald with Radio Canada. Please go ahead.
Hi, Dr. Moore. The government is set to announce a plan next week to relax certain measures. So in your opinion, when should some of those take effect? For example, when should we lift capacity limits on restaurants? And when should the vaccine passport become voluntary?
Well, I have to applaud the government. We are going to take a slow and steady approach to the removal of any public health measures over time based on the data at hand. So we still have to monitor for the effects of the Thanksgiving weekend and whether there's been any spread of the infection in any of the communities across Ontario. The plan that we're implementing starts when you introduce a public health measure, you always have to think of when it may not be further necessary. So with all of our public health measures, we've always thought of what would be the indications for the removal of these. And what we're trying to do for Ontario in partnership with the direction from government, is to provide advice to them on when public health measures could be removed and what would be the basic indicators. That schedule we're working on and we'll be providing to government next week. And all of these decisions are always the final decision of government. But we think that our plan is a slow and steady approach, as Ontario has always done. It has brought us great success as a province. Our Ontarians should be proud of how they've limited the spread of Delta as compared to any other Western country. The adherence to masking, hand hygiene, distancing, as well as ever-increasing immunity through vaccination has been a great formula for protecting our businesses, our communities, our schools, our colleges, universities, and our families. And that strategy will continue, but we'll be able to provide guidance to both businesses and to the community at large of when we see from a public health vantage point some of the measures could be removed. We will not be doing this suddenly. This will be slow, gradual, and cautious, following data like we've been doing for the last year and a half.
Follow-up?
Okay. On another topic, is Ontario going to follow the lead of Quebec and other provinces and offer third doses to people who need it to travel to the U.S., people who have received mixed doses here in Canada because of the CDC recommendations?
Well, the good news is from work that's been done both in Quebec and in British Columbia and recently shown to me by Dr. Kwong at the Institute for Clinical Evaluative Studies, we have very good immunity. Number one, we have good science, but we also have documentation of good immunity through our mixed dosing strategy, and especially the intervals that were put in play in Ontario and in Canada of 3 to 4 months between doses. That appears at present to be able to provide good, high levels of long-acting immunity, and that data is enough to support our immunization strategy being accepted by any country internationally. It is the responsibility of our federal government to provide this data to our international partners, but I have no doubt once they see the data, they see the strong protection of our mixed dosing has done and our intervals, that our immunization strategy should be accepted globally as some of the best strategies in the world. And providing long-acting immunity. So this is a federal responsibility. The science that has been provided to Ontario would only help that discussion at an international and national level.
Next question.
Your next question comes from Randy Rath with CHCH-TV. Please go ahead.
Yeah, hi, Doctor. To get back to Natasha's first question, I didn't really hear an answer to it. What are the benchmarks that you need to see before you recommend to Cabinet, the government, that they lift restrictions on restaurants?
Oh, so the benchmark globally for us to further lift restrictions are what we're very familiar with. They would include total cases on a daily basis and that longitudinal trend, whether we're heading in the right direction, especially going into closed spaces and closed spaces in winter and fall. Number two, impact on the hospital sector, so hospitalizations and patients in the intensive care unit and in the intensive care unit, those that are requiring ventilation, because those are fixed resources, finite resources that we can't rapidly have surge for. Number of people getting tested on a daily basis is another metric I look at, and the percentage of those tests that are positive. If we have a high amount of testing with low positivity, that tells me that we have good surveillance, that we have good monitoring of the presence of COVID in our communities. Right now, all of those metrics look very, very good. And hence, I think it's a realistic and reasonable conversation to have with the community at large of what would be our vision to remove public health measures over time. Again, I will state we will do this cautiously, slowly, monitoring data. The trends are good at present. We still have to wait for the next 14 days of what the impact of this long weekend has been. But have to thank Ontarians. They are doing the right things, and by having the right actions, they are limiting the spread of this virus. And it's working for us at present. And as a result, I do believe we can lift measures in a proportionate way, in a timely fashion, and slowly to allow our economy to fully recover.
Follow-up?
Hey, thank you. Also, is there the possibility that the restrictions can be lifted on a regional basis if we have, hot zones in various regions, that they would be done later than zones that are doing well?
You so much for that, because there are significant regional differences across Ontario now, even just with immunization rates. I have to thank the people of the Thunder Bay District. They've achieved over 92% first doses. Leeds, Grenville, Lanark, 97% of their eligible population has been immunized. Ottawa's 90% and above. Waterloo's 90% and above. So with that level of protection in communities, the virus should not be able to spread rapidly, and we shouldn't see explosive outbreaks. We should see a benefit from immunization at a population level. And as a result, I do think going forward, we will have less provincial measures put in place, but regional responses to put out any activity in any localized community. So I've set up my office that we provide regional consultation now to our local public health officials and medical officers of health, and try to control any activity at a regional level to stop it rising provincially. And so far, so good. We've been excellent at having test turnaround times that are rapid, that allow public health units to respond over 95% of the time within 24 hours. They're contacting cases. The contact management, even though people are having more contacts these days, is still working well to limit the spread of infection. So that process of regional limitation of the spread of the virus is working, and it certainly is my hope that we don't have to impose any further restrictions at a provincial level and work regionally to control the spread and allow regional economies to prosper and benefit from high levels of immunization.
Next question.
Your next question comes from Matthew Bingley with Global News. Please go ahead.
Hi, Doctor. Just on the vaccination certificates, could you just clearly say what you would have to see to actually move that to a voluntary basis? Is it something like you were just talking about with certain regions where they are very, very high, above 95%? Do you have a number for each region for your magic number to say that people no longer need the vaccination certificates in those zones?
So, great question. What we're anticipating doing is, as you know, the immunization certification process is in play across multiple domains. What we see is a phased removal of domains requiring verification of your immunization as we have very low rates across Ontario. So we may not require them in some venues, but still require them in mass gatherings where we have a large number of people gathering. So we're still reviewing that science and getting the input of our experts, but we do not see the whole certification process ending suddenly, but having a phased exit from it over time following data. That safe, gradual removal of public health measures has done us well in Ontario all along, and we want to continue that process. I do see us monitoring the data going forward. The risk times are always holidays and the 2 to 3 weeks after it, so I can't see us eliminating them until we get through some of the difficult holiday times, but those are just general numbers. If we continue to make great progress in our immunization strategy, I could see us eliminating these public health measures sooner, and we have other interventions that may also help us at a population level, whether we get effective oral medication that could limit the impacts of COVID once you're diagnosed, and or other effective vaccines. Some people don't want to receive the mRNA vaccine, but we may have alternates that are highly safe and effective as well to the mRNA vaccines for adults. And we're working with Health Canada and Public Health Agency of Canada to understand the pipeline for those various products that could affect the requirement for public health measures.
Follow up?
Yeah, thank you. And just on your announcement last Friday, speaking to a lot of small businesses that were not allowed to see their capacity levels limit and hearing about it through a press release before a long weekend, many of them are telling us they felt insulted by it and are still not hearing the level of detail as to why they were left out. I'm wondering, do you regret the way that you presented that information, and could you just clarify to them why they were in fact not allowed to expand capacity while arenas and concert halls were?
Well, I personally regret any issues with communication with any partner, and absolutely want any public health measures to be proportionate to the risk. And I'm very sensitive to the negative impacts of public health measures to any business. So that's clear, and I've said that multiple times. We want to be responsive to the data. We want our economy to open up safely and effectively. I do see that restaurants, especially with the certification and validation, once we get through this weekend and know the impact of Thanksgiving, we will be reviewing the maximum number of people that can be within those businesses and or any distancing requirements. Eventually, this decision is the government decision. It's not mine. It's that of the government. But I hope, as we're through this weekend and get further insight on the impacts of potential spread at Thanksgiving, that we'll be able to make a recommendation to government to further open up any businesses that have had untowards or negative effects. But as again, it's data-driven. I know there's various opinions on when to open up what business over what time, but my commitment is that we'll follow the best evidence, that we're absolutely want a balanced and proportionate response from a public health vantage point, that we will provide our best recommendations to government at every opportunity and help them be informed through best evidence and expert opinion.
Next question.
Your next question comes from Colin DeMello with CTV. Please go ahead.
Hi, good afternoon, Dr. Moore. So I wanted to continue on that vein. I mean, you said just a few minutes ago that when it comes to restaurant restrictions, quote, we will not be doing this suddenly. Yet last Friday, there was an announcement made that took effect in 24 hours. So the decision on full capacity in large sports arenas, I'm trying to understand how this process worked here. Did you approach the government and say, hey, Premier, now it's time to lift capacity limits for large events? Or did the government come and ask you to approve a plan that they had already formulated? And when exactly did this conversation take place?
Great question, Colin. So as I said earlier today, we make decisions. Once we implement a public health measure, we're always looking at the exit strategy for a public health measure. And so when we imposed restrictions to any facility, we had always thoughts of opening and a progressive reopening over time. So it wasn't just last week that this suddenly came in. The minute you impose a public health measure, you should be thinking of what would be the indicators for it to be removed. So we have been having these conversations with government for months and reviewing the data on a daily basis, reviewing best evidence of when we can safely reopen. It's very, I hope you're hearing in my voice, it's very dear to us to be proportionate, to be reasonable, to be prudent when you put in public health actions. I know the negative implications for businesses and for people's livelihoods, and it's a very delicate balance that we try to maintain. Proportionate, keeping businesses open, but also keeping our communities safe. And sometimes these decisions are difficult. They're debated regularly, and these decisions to impact businesses have to be lifted over time. We made a decision and recommendation to government. It has been adhered to, and we are cognizant of the negative effects on businesses and want to remove them safely, effectively, efficiently over time. Bear with us. We will get through this weekend, after the long weekend. We'll continue to monitor the data, and hopefully we'll make recommendations to government for further opening of our economy. Some of these decisions are made quickly, and I'm sorry if there's been short notice to some. We'll try to give further information over time, and hence I think the reason we want to give a picture over the next 3 to 6 months for transparency's sake, for accountability's clarity sake of when currently we're thinking of removing measures to give all of our community an idea of how we can progress through this Delta wave and ensure our communities remain safe and remove measures in a slow manner that maintains our health, that stops the impact on our hospital partners, that keeps Ontarians safe. It's working. Debate is healthy and absolutely open to discussing these issues, but eventually a decision has to be made based on evidence, and sometimes these decisions are made quickly.
Follow-up?
Thank you. I'm wondering if you watched the Leafs game last night at the Scotiabank Arena. People from different households were sitting side by side, limited masking because people were eating, a lot of people cheering as well. Is that what you imagined, Dr. Moore, when you approved the lifting of all capacity limits for the Leafs game?
So it's important people recognize it's a risk reduction strategy, having a verification, certification process in play in our communities. It's not a risk elimination. And so going to these venues, I hope people that go there are healthy. They've been 2-dose immunized. They're screening before they go. If you have any risk to your health, I would not advise going to a mass gathering at any point, even with 2-dose vaccinated. So please, when you go to these venues, there is a risk. It's not a risk elimination. It's a risk reduction. We hope Ontarians continue to adhere to best practices on distancing and masking, hand hygiene, screening and testing. All of those have done us well. But anytime you're going to these venues, there is a risk, and not all people will adhere to the best practices.
Last question.
Your final question comes from Jeff Gray with the Globe and Mail. Please go ahead.
Thanks. Hi, Dr. Moore. Can you hear me all right?
Yes, sir.
I wanted to ask about the letter sent to doctors urging them to start seeing patients in person again. Just two points on that. One, how big a problem is that, and what happens if doctors don't heed this advice?
So this is a recommendation, and I don't think there's any consequences from the college or from the ministry. It's purely a recommendation. I have been a family doctor and an emergency physician. I absolutely understand that from a clinical practice vantage point, it's so important to see people in person. You can't do a physical exam. You can't take a blood pressure. You can't provide immunization through any virtual means. And patients need to physically get seen and physically examined. And we have gone through a rough year and a half where patients have perhaps not felt comfortable going to their family physician's office. And some family physicians may have not felt comfortable providing direct one-on-one care. All of that is changing now when we have high immunization rates in our community, low risk of infection, very good understanding of infection prevention and control and clinical practices, good guidelines that have been put in play, good screening. So I think it's much safer now to be able to see patients. I am concerned of a backlog in patients that have not had a physical exam, that have not had their heart or lungs listened to if they've had respiratory or cardiac complaints, that haven't had their blood pressure physically checked, that haven't been able to be immunized or had any basic cancer screening such as a pap smear. So all of that backlog, we hope over the coming year can be met, and that has to be done in person. We'll be monitoring, because we can look at this from a billing perspective, whether the trends are heading in the right direction, whether primary care physicians are going back into their offices. But we've done this letter in partnership after consultation with many family physician organizations, many partners across primary care across Ontario. And it's a consistent voice we've heard from patients that they want to be seen, as well as from physicians that want to see their patients again, given that they know that the requirement, the need to see patients directly is so important.
Follow up, and this is the last question.
Thanks, yeah. And just going back to some of the questions others have asked, I wondered if you could lay out for people, I think one of the points that some of the small restaurants were raising was that they wanted someone to explain why is it that the Scotiabank Arena with 20,000 people, can you explain, you mentioned data-driven decisions, but why was that deemed not safe, but a risk that was manageable compared to, say, a restaurant down the street? Why couldn't they have full capacity as well? Can you explain the difference between the two and why one has to wait another few weeks?
Yeah, so important to notice that it'll probably be a couple of weeks before we'll have clear data, so it's a small time frame to wait, and we hope that business sector will get greater clarity next week after government reviews the data. I liked what Dr. Juni had said in that one space where you're having appropriate screening, cleaning, vaccine management, and good ventilation, known air exchanges, etc., as compared to those 20,000 people spread across multiple different establishments across a city. The risk is different, we had assessed prior waves where infection had been detected and spread, and we actually looked at one of his major reports on wave 2 and wave 3, which did an international search, and restaurants, clubs, nightclubs at that time, without verification processes, were high-risk venues, and with that body of evidence, and that can be found on the Science Table website. With that body of evidence, that was a strong instruction that in terms of prioritization of what avenues to open first, the restaurants, bars, nightclubs, we're going to just need a few more days to ascertain risk. We found that opening of the larger venues has been safe. We're in regular contact with our public health agencies such as Toronto and Ottawa. They had not found spread in those any significant spread in those environments, and as a result, we kept them open and increased their capacity, but will review further evidence to support the reopening of other establishments, including restaurants. And I think we'll be providing that evidence base to government next week, and stay tuned.
Thanks, everyone.